Today is National Caregivers Day, and new data from AARP and the National Alliance for Caregiving shows a nearly 15, or should, I should say 50% increase, nearly a 50% increase in family caregivers since 2015. We're joined now by Tina Boggs, who is a local caregiver. Tina, we appreciate your time. We appreciate the work that you do. Let's start here. Why this rise in family caregivers?
Well, Zach, thank you for having me today. Yeah, I mean, with the baby boomers and just the aging population, we're definitely seeing a rise in, um, people who are turning unexpectedly into caregivers for a family loved one. It's about 1 in 4 individuals find
What is,
themselves having to care for someone.
I'm sorry, I didn't mean to cut you off there, Tina. A question for you, a follow-up. When we talk about this rise in family caregiving, what does it mean for those who are in need of and are receiving the care? And also, what does it mean for the family members who are providing that care?
Well, it's sometimes it's a pretty impactful and unexpected situation. It can be very stressful. It can be financially impactful. It's it's something that no one can really plan for unless you have taken the time to put those things in place through your financial planning. And it can be very stressful when you're trying to take care of your own family, trying to keep up your own jobs, and then also worrying about a loved one. It can be very stressful and can impact your own health as well. So, lots of different factors that can take place.
What advice would you give to those caregivers who, as you have very rightly pointed out, are juggling so much?
Yeah, I think if you have someone, it could be someone that's obviously declining in your or age, getting older in your family, or it could be even some folks can find themselves being a caregiver unexpectedly. So I think it's just making sure that you're planning appropriately. I think you got to make sure that if you do find yourself in a situation where you're starting to have to provide care for someone, that you make sure you pay attention to your stressors. And as things start to build and you start to have that overwhelming feeling, that you're making sure that you're reaching out and you're getting a support system around you, reaching out to different agencies like ours with Seniors Helping Seniors, where we can come out and at least take some of those things off your plate to help you get a moment to just relax and to be able to get that break that you need to stay healthy and to look after yourself because none of us can really care for someone else if we're not able to take care of ourselves as well through that journey. So yeah.
And does it help too, Tina, to just be able to talk with other folks who are going through the same thing that you are, if you are in that position where you're caring for a loved one?
Yeah, absolutely. So one of the things here at Seniors Helping Seniors that we like to do is we like to help families kind of prepare, and we like to let them know what all the resources are that's available to them. Because again, sometimes people are navigating this for the first time, and they're just not really sure where to turn or what to do or who to reach out for help for. So that's part of the program here with my agency is that we like to make sure that we're providing you that assistance to help you navigate that. And then we even do support groups here. Sometimes people are fighting dementia and they are navigating that process, as you can imagine, is overwhelming. So just finding those support groups and people that are going through it. And, we always like to ask the question, if this happens, then what? So that we can help give you some tactical ways of handling and dealing with that to keep your loved one happy and
All right, Tina Boggs, local caregiver with Seniors Helping Seniors, joining us today on National Caregivers Day. Tina, thank you so much for your perspective and your time. We really appreciate it.